Hello, my name is Jonathan Burleson, and this is Navigating Medicare.gov, provided by the Nebraska SHIP. Before we dig into the demonstration of Medicare.gov, first, let's just briefly touch on who is providing the education. Nebraska SHIP is a federally funded member of the National SHIP Network. We also administer the state's SMP, the Senior Medicare Patrol. This funding from the federal government provides a SHIP program office and SMP office within each 50 state and U.S. territory. We are typically managed by a state agency. Here in Nebraska, we're a division of the Nebraska Department of Insurance, and we have 7 locations throughout the state to serve. Our locations do include Omaha, Lincoln, Grand Island, Kearney, North Platte, Scottsbluff, and Norfolk. We serve the state through a network of volunteers through the Area Agency on Aging offices, as well as volunteers assisting seniors in the Omaha area. We exist to provide confidential and unbiased Medicare education and counseling. If you call our toll-free hotline, you will be able to pick the location nearest you to speak with a certified Nebraska SHIP SMP representative. Now, let's dig into the demonstration of Medicare.gov. Okay, so here we see the home page of Medicare.gov, and certainly we see here that the website does have that message. Open enrollment starts October 15th, and we can certainly see that we can preview the 2024 plans. Now, this recording is taking place on October 14th, 2023, so that's why we do see this message. Certainly, if you are viewing the Medicare.gov website after October 15th, this message will probably be different. Now, here on the website, you do see there is some great useful information for folks that might be getting started with Medicare. Certainly, there is that opportunity to log in or create a Medicare account. The tool we're going to use is this one here, the Find Health and Drug Plan option, a very nice comparison tool. Certainly Medicare.gov also provides you a tool for you to find care providers and certainly compare those providers with some excellent information and detail. Of course, you can always reach out to Medicare directly if you do want to talk to somebody, but do keep in mind, of course, that you also have your Nebraska SHIP, the local source of Medicare education here in Nebraska. So, as I said, we're going to go ahead and focus in on this Find Health and Drug Plans. I'm going to go ahead and click that here. That is going to go ahead and take us over to the beginning of exploring the Medicare coverage options. We do see here that the coverage for 2024 radio button has been already chosen. We do have a zip code already populated at 68508. We're going to go ahead and hit continue. Now, the next thing is we do need to indicate what we're looking for. Are we looking for a Medicare Advantage plan? Are we looking for a Part D prescription drug plan? Or are we looking for information about Medigap policies? We're going to go ahead and click the radio button for Medicare drug plan coverage and hit Find Plans. Now here, certainly the Medicare.gov website does provide a wonderful tool that can help folks better navigate through their options in the event that they receive help with their cost, potentially in the form of Medicaid or potentially extra help. In this case, for this demonstration, we're going to go ahead and click the last button. I don't get help from any of these programs, and I'm going to go ahead and click on Next. Now, the great thing about this tool is it does give us the opportunity to enter prescription drugs in order to evaluate the drug plan options that much more effectively. So if you are a person who does take prescriptions, you will want to click on the Yes radio button here. Certainly, if you're a person who does not take prescriptions, you can go ahead and click on No. Proceed with the next button to see the plan options that do exist. But for this particular demonstration, we're going to go ahead and click on the Yes button. We're going to then click on Next, and what that's going to provide us is the opportunity to enter prescription medications. So we're going to go ahead and start by clicking in this search field. And what's great about the Medicare.gov tool is as you start typing, it does start providing suggestions. So if you're not quite sure about the spelling of a particular medication, you do see that the tool does give you the opportunity to kind of sort through the most probably qualified option for what you're typing. In this case, I did intend to type atorvastatin, so we'll go ahead and choose that option. Now that it's fully typed out, we can hit the add drug button here. And when we do that, we see that we have this opportunity to define the prescription a little bit further. We have that option of choosing the dosage of the prescription. In this demonstration, I'm going to go ahead and leave it on the 40 milligram. Certainly, we can um, modify the quantity. This is something that you might do if you have a different refill frequency. For example, if this were a prescription that were refilled every 3 months and it was taken once a day, we would want to modify that quantity over to 90. And certainly that is something to keep in mind when you're doing this evaluation, is to keep in mind that quantity versus the frequency. For this demonstration, I am going to leave everything on a 30-day refill, so I will go ahead and edit this back down to 30 to reflect a once daily. Once you know the quantity and the frequency has been entered correctly, as well as the dosage, of course, you can then hit the Add to My Drug List button. Now, from here, you see there is an opportunity to either add more drugs or, once complete, to go ahead and proceed. In this case, we're going to go ahead and add some more prescriptions just to add to the demonstration and offer an ability to be able to show some differences in what to look for. Now, the next prescription I'm going to enter is going to be lisinopril. So as I enter that, you see the lisinopril does populate here for us. Certainly, again, there's those options of being able to choose these other ones here. I'm going to go with the first one and hit Add Drug List, or Add Drug rather. In this case, again, you can change the dosage. I will leave it at the 10 milligram. Again, we can modify the quantity. I'm going to leave everything at a 30-day refill moving through this demonstration. So then I'm going to go ahead and add this to the drug list as well. We're going to add just a couple of more prescriptions. The next one I'm going to add is metoprolol. And why I want to add this particular drug is because there's a little bit of a point to make here. Sometimes with prescriptions, we see that they might have another name following it. So in this case, metoprolol tartrate, this particular drug is a shorter acting prescription and might be taken more often, whereas the metoprolol succinate, it's a longer acting drug and might be taken perhaps only once daily. So if you do have this particular drug or any prescription, and you're not quite sure of which one it is, it's always a great idea to grab that pill bottle and take a look. If you're not quite sure, reach out to the pharmacy to make sure that you are entering the correct prescriptions, because certainly choosing the wrong prescription can affect the results, and potentially you might be making a decision based on incorrect information. So really, again, you do want to make sure that you're verifying these types of things. For this demonstration, we're going to go ahead and go with the succinate option, and go ahead and add to the drug list. We'll leave this at a 25 milligram, but I will modify that down to once a day, because as I said, it's the extended release, and typically we do see that prescribed once daily, but you're going to enter whatever it is that you are prescribed with your particular prescription drug list. So the next one I'm going to add, just to kind of make another, point out another point here, we're going to go with the levothyroxine sodium. And when I add this, why I chose this particular prescription is because when we look at the prescription drugs, we do want to not only make sure we're choosing the correct drugs based on name, but we're also choosing the correct drug based on how it's administered. Is it a capsule or is it a tablet? You see, for levothyroxine, all of these different dosages, these microgram dosages, appear as capsules, but they also also appear as tablets. So for this demonstration, we're going to go ahead and go with a 50 microgram tablet once daily. We'll go ahead and add this. But again, a great thing to keep in mind when you're doing your evaluation, you want to make sure you're making sure you're entering the correct way it's administered, because certainly tablets versus capsules, you might find that there could be a difference in cost when a refill is done. Now, I'm going to add one more prescription, and this is going to be a brand name because I do want to kind of show how the tool works as far as if we have higher cost. I want to show that demonstration of being able to move us through that. So I'm going to go ahead and enter in Eliquis for this particular demonstration, and we'll leave it again at the 5 milligram. It looks like it can be taken twice daily, so we'll go ahead and leave this at this particular quantity and frequency. But again, as you're entering your prescription drug list, make sure to enter what you yourself actually take. Now, once the prescriptions have been entered, you do have that option, as I said, to go ahead and finish. And what's going to happen next is we are provided the opportunity to choose some pharmacies. Now, certainly, mail order pharmacy typically will be available from many of the prescription drug plans. But beyond that, we do encourage folks to choose more than one local option. And certainly, if we need to, we can modify and apply a distance filter within these searches if we're looking for a pharmacy that's potentially not within the given radius. For this demonstration, we'll go ahead and leave it at the distance of 5. I'll go ahead and choose Walgreens just arbitrarily, and just for demonstrating purposes, we'll go ahead and just go with a couple more options. You see, as I'm selecting those options, they are being populated at the bottom of the list, or the screen rather. We do have that option of choosing up to 5 pharmacies to compare. So because I just want to be able to demonstrate that, we're going to choose one more. And why don't we go ahead and choose Lincoln Pharmacy just to round it out. I'm going to go ahead and click the Done button here in the bottom right corner. And once I do so, what this tool is going to do is it's going to take a look at all 22 prescription drug plans available in the state of Nebraska, and it's going to put them in order of prescription, or rather potential estimated cost. So when we look at this list, we see it's showing the top 10 of 22 drug plans. This list is being populated based on the retail cost, the estimated total drug plus premium cost. So what this dollar value is indicating, the $1,722, this is indicating a person's total out-of-pocket cost for the calendar year 2024 if the prescription list I entered were their particular drug list. Now, the $1,722.11, it includes the $20.20 monthly premium throughout the entire calendar year. It includes the deductible of the plan. $545 is the maximum deductible allowed in the U.S. in plan year 2024. So we do see, because we did choose the option of evaluating mail order pharmacies, or the mail order pharmacy option rather, that we do see that that option within this particular plan does provide a lower quoted cost versus the retail pharmacy option. So let's go ahead and kind of follow this through just a little bit further. The 172211, when we hit on the plan detail button here, what this is going to do for us is give us a little bit more of the information. So of that $1,700 that we saw previously, we see that through the mail order pharmacy, I'm going to go over here rather, of the 1,700, we see that $1,479.71 is what this individual would spend on the prescriptions through the retail pharmacy option. We do see all 5 of the prescriptions we entered are covered. Now, if the individual were to go with the mail order pharmacy, we see that that projected out-of-pocket cost for the prescriptions themselves is just shy of $1,400. Now, as we progress down this screen, we just get that quick overview, a reminder of the plan premium, a reminder of the plan's deductible, and we do see that there is a plan address contact information listed here. Beyond that, under the drug coverage, we do see the pharmacies that we did enter to be able to evaluate. And what's nice about that is it does give us this opportunity to see the different pharmacy options that can exist within a plan's network. Preferred pharmacies typically are going to be a pharmacy that may offer a lower copay for the prescription at the time of refill. An in network pharmacy certainly is a pharmacy that you can go to. However, you may experience higher out of pocket costs in refilling those prescriptions. Certainly, an out of network pharmacy, the insurance simply does not work with that particular pharmacy, and it's probably not a good idea to go if the insurance does not work. Certainly, in this case, we do see that the Walgreens, the Lincoln Pharmacy, and the mail order pharmacy are all preferred within this given plan's network. Now, beyond that, we see the tool provide us a yearly drug cost by the pharmacy. So for the atorvastatin, we do see that if this person were to go to the Walgreen pharmacy, they would spend $23.82. That's the projected estimated cost for the entire year of that one prescription. Now, certainly we see that that amount is lower than what is being quoted through the in network pharmacy option of CVS. So, this is that demonstration that typically a preferred pharmacy will fetch a lower cost. Interestingly enough, when we do take a look at that mail order pharmacy at the end, we do see that that value is the lowest at $14.40 for this given prescription. Now, as we progress down the med list, we do get a feel for, again, each individual's cost at those different pharmacy options. In this demonstration, we see that Eliquis is the cost driver. Essentially, we're seeing about a $1,300 to $1,400 responsibility for this prescription over the course of the year through the in-network or preferred in-network pharmacies. Beyond that, the levothyroxine sodium, we do see again a difference in cost, basically anywhere from $7 up to $103 for that cost responsibility. So, in this particular demonstration, we do see that the mail order pharmacy does perform quite well with regard to these other prescriptions on the list. Now, when we progress a little bit further, we see that the drug cost, and let's go ahead and just take that mail order pharmacy cost, the $1397.10. When the plan premium is added to that amount, that's what gets us up to that projected cost of $1,639.50. What's nice about this tool is it also gives us a view of how a person may progress through the coverage levels provided through the Medicare drug plan coverage. So in this case, we see that this individual, if going to Walmart, they would meet their deductible in January. If through CVS, they would meet their deductible in February. Certainly entering the coverage gap. And if we want to know a little bit more about that, we can hit that drop down arrow and see that the definition of the coverage gap, also called the donut hole, is when you would actually pay no more than 25% of the cost for covered drugs, but the full price will count toward getting out of the coverage gap. So in this case, this person, if they went to Walgreens, they would hit that coverage gap in the month of September. That, in fact, is consistent for CVS, for Lincoln Pharmacy, and we see just a little later in the year through the mail order pharmacy. We see that in this case that the individual would not get outside of that coverage gap. So it is something to take into consideration when you are evaluating these options. Now, what's great about the tool is it also provides an estimated projected budget for each calendar month. So, if this person, for example, were to go to the Walgreen pharmacy, we see that January would, of course, be their most expensive month, $572.35 as that out of pocket responsibility to pick up those prescriptions from that particular pharmacy. Thereafter, because the deductible has been met, we see that the individual's responsibility is at that $54 value for those months of February through almost the end of summer, basically August. But then, as we saw indicated before, this individual then enters that coverage gap where the cost responsibility is then the 25% of the cost of the prescription. So we see here in September, the individual's cost responsibility goes up from the $54 experienced through initial coverage, up to the 135.81, entering that coverage gap, and then of course finishing the final quarter of the year at 148.82 per month in that final part of 2024. So certainly this tool is providing an opportunity for an individual to be able to get that fill for a potential budget with regard to their prescription drug cost. Now, certainly, if we did want to dig into the individual costs throughout the year, we could certainly do that. What we see here is the cost of the prescription, the atorvastatin, for example, $7.75. In order to meet the deductible, the cost is $2. After the deductible is met, that cost remains at $2. In the event of entering the coverage gap, the cost is 25% of its retail cost, meaning it's $1.94. Now, certainly if a person were to exit the coverage gap in the year 2024, the cost responsibility at that time within what's known as catastrophic coverage will actually be zero beginning in 2024. So just to kind of drive that point home, the Eliquis, we see the retail cost of that prescription is $560.35. Cost before the deductible certainly would be that full cost to meet the deductible, and then once the deductible has been met, the cost after the deductible shown here at $42, and then of course that 25% share when entering the coverage gap. And then, of course, again, if an individual were to spend, I believe in 2024, the true out of pocket cost at $8,000, that then puts that person in catastrophic coverage where the cost responsibility in 2024 again will be zero. So definitely cost we see can be a challenge, but at a certain point does potentially go away depending on an individual's prescription drug list. Now, going down, we do see there is this opportunity to view more about the drugs. But before we do that, I'm just going to touch briefly on the star ratings. We do see that this is an opportunity to get an idea of how the plan is performing. And if you click on the expand, you do get that breakdown of how the star rating has been determined. We see that the drug plan customer service is a factor, member complaints and changes in the drug plan's performance is a factor, member experience, and of course, safety and accuracy of drug pricing is also a consideration when trying to come up with an overall star rating. So that is certainly something that might come into your consideration. I'm going to go ahead and collapse that. And just make the final points of when you are evaluating your prescription drug plan, you do want to take into consideration those kind of other little bits of details. So essentially what we're seeing here is the cost of the prescriptions with regard to their tier levels. So tier 1, typically the preferred generics, we usually see a lower out-of-pocket cost. If entering that coverage gap, as I stated, 25% of the cost is the responsibility responsibility. But again, in 2024, if a person exits that coverage gap, we do see the cost responsibility at zero. Tier 2 drugs have a $6 responsibility. Tier 3 drugs, a $42 responsibility. Tier 4 drugs, a 46% co-insurance responsibility. And certainly if a person had a Tier 5 specialty drug, they would see 25% responsibility for that particular medication. All of those, of course, are during the initial coverage phase. Now, if a person wants to know where their drugs lie within that tiering system, we see that as we entered the information, the tool does indicate where the prescription lies within its tier system. So we see that Eliquis is at that tier 3, and that tier 3 was that $42 copay. And just to kind of see that demonstrated here, we saw that $42 copay for the prescriptions during that particular coverage level. That, of course, added to the $2 for the atorvastatin, the levothyroxine, and the lisinopril, plus the $6 for the metoprolol succinate. That's what got us up to that $54, which you did see demonstrated up here through that Walgreens pharmacy for those months of, again, between February through August. So definitely the expanded drug coverage information does really give you that ability to be able to see more about the coverage of the prescription. Also, this gives us that opportunity to see whether or not there's potentially restrictions. Restrictions can come in the form of prior authorization, quantity limit, or step therapy. In this case, we do see the atorvastatin has a quantity limit of 45 within 30 days. The Eliquis has a quantity limit of 74 within 30 days. In this case, the quantity limits do not affect the prescribed treated therapy for the individual, because in this case we saw the atorvastatin was at 30 every 30 days and the Eliquis was at 60 every 30 days. So those are the other things to take into consideration. Certainly if there are restrictions that potentially affect the prescribed therapy, we might see the need to look at a different plan, or if already enrolled in a plan and there are restrictions in place, there are avenues such as requesting a formulary exception request, essentially kind of going through that appeal process, if you will, to get prescriptions covered where there might be an authorization or a quantity limit or even a step therapy restriction in place. So definitely the Medicare.gov website does really provide some wonderful information for you to evaluate when you are looking at your prescription drug plan options. Now I'm going to go ahead and just keep going back to the top, because at the top we do see there is this button, back to search results. I'm going to go ahead and just make a couple final points in this video before we conclude. One of the things that's great about this tool is you can put some plans on a side-by-side comparison. I'm going to go ahead and put these plans, the top three, on a side-by-side comparison. You see at the bottom that you do have that opportunity to compare up to 3 plans side by side. When I hit that compare button there, what we do see is essentially not only the plans side by side as far as name and premium cost, but we also get to see the difference in star ratings. And this particular plan apparently does have a caution, has received low rating from Medicare for at least 3 years in a row. So that might be something that a person may take into consideration when they're looking at these options. Now, one of the other things to view is the difference in the deductible. You see the deductible is significantly different between these plans. Higher premium cost, no deductible, whereas lower premium potentially higher deductible. We do see that all of the plans do cover all five of the prescriptions. And then, of course, here we get to see that estimated cost. Again, total drug plus premium cost. What a person can do here potentially is if they really are trying to evaluate what pharmacy to utilize at the lowest cost, this is that great way to be able to see side by side. Well, if I use the mail order pharmacy here, I'm at that 1639, that plan that we were evaluating previously. Mail order pharmacy through these plans, we see that cost at 1740 or basically $1,800. So what a wonderful tool that you have available when you are evaluating your Medicare Part D prescription drug plan options. Certainly, you are really encouraged to utilize this tool to secure the best plan, offering really the best coverage at the lowest cost available. Now, certainly if you're a person who does have interest in those Medicare Advantage plan options, you see there's a button there where you can toggle over and take a look at those specific plan options. So right now, I'm going to go ahead and conclude this particular video since we did want to go ahead and focus on the Part D side. Definitely, there should be a Medicare Advantage plan video available soon. Stay tuned for that, and thank you for taking the opportunity to stop in and participate in navigating Medicare.gov. Thanks.